Hi, my name is Stephanie LeBlanc. I'm one of the physician assistants here at Pediatrics West, and I'm here to talk with you about constipation. Who doesn't want to talk about constipation? I think it's an important thing to talk about because we see it in pediatrics all the time. We talk about it in our office several times a week for all ages, infants through adolescents, teenagers, young adults. It is not uncommon for constipation to be a cause of belly pain, especially belly pain that seems to be associated with around the time that a kid will eat. And so it's always on our minds as something we're thinking about if somebody has sort of more chronic, not acute belly pain, especially in the toddler years. So constipation can look like crampy belly pain, especially lower belly pain or left-sided lower belly pain, hard stools or large volume stools, straining when they're sitting on the bathroom, or if it's been several days since they've had a bowel movement. All of those things are making us think about constipation as a potential diagnosis. For infants that are constipated, you may see some harder stools. They may do lots of straining, especially if they're spending a lot of time on their backs. If they're doing solid foods, or we're even headed into the toddler years, we're looking more at making sure that these kids are well hydrated. So kids that are really well hydrated, drinking plenty of water, are gonna have softer poops. Constipation shouldn't be as much of an issue. So hydration, hydration, hydration. Thinking about getting high fiber foods into their diet. So again, prunes, pears, peaches. You can try a little bit of apple juice if you're concerned that they're acutely constipated and they're having some pain. And then mostly we wanna make sure that they're going to the bathroom regularly. So lots of toddlers are just too busy to go to the bathroom regularly. So reminding them over and over to use the bathroom, to sit up nice and tall. When you're out in public and they're playing with their friends, you might want to remind them when they get home to use the bathroom to help keep everything moving. And then as they get older, or if we're dealing with more chronic constipation, that's when we start talking about using things like Miralax or a laxative as kids move through the toddler years into adolescence and adulthood. And if you've got concerns that this is becoming more chronic, or we're having worsening belly pain and you think it might not be constipation, certainly we want you to come in and see us and talk about it. If you have any other questions, it's always important to give our nurse triage a call, or you can schedule an appointment and come in and talk with your provider at any time. And that's all I've got. Thanks.